I practice at the Allogeneic Blood and Stem Cell Program at Princess Margaret Hospital, Toronto, where we perform on average 75 bone marrow transplants a year. As a major referral center for the province, many of my patients live greater than 100 kilometers away from Princess Margaret. The nature of their treatment plan requires frequent visits to the hospital for post-transplant care. Traveling every week or two to our clinic in Toronto, combined with their complex symptom issues and an overwhelming desire to be cared for in their home community, are the major challenges facing our patients. Patients like Daniel typically require intensive follow-up due to the complexity of their post-transplant complications, and in particular, graft versus host disease. Skin rashes, ulcerated oral mucosa, and swallowing difficulties are all complications of long-term chronic graft versus host disease. Consequently, an in-depth clinical evaluation, primarily of the response to immunosuppressive medication, and timely symptom management is critical. You have to stay on top of the symptoms for your patients to do well. Daniel was having difficulty with chronic, unstable graft versus host disease, which was affecting his quality of life, causing him considerable oral pain. He had been started on a course of high-dose steroid medication, typically requiring close monitoring during weekly hospital visits. We recognized that attending weekly hospital appointments in Toronto might be a challenge for Daniel, given the distance from his home. We had tried close telephone monitoring with coaching for symptom management and prednisone weaning for him, but it was not a viable treatment delivery option, as a key element was missing, the visualization piece. We could talk to him, but not see him to evaluate how his mouth was responding. Also, Daniel wasn't confident with telephone advice to reduce his medication. Relocating to urban Toronto was not a feasible option either. He was very determined to stay close to hearth and home, irrespective of the impact on his health status. Telehealth video conferencing is a way for us to conduct a virtual visit with Daniel to manage his complex symptoms. Through an e-clinic, I can follow Daniel without him having to leave his home community. Recent advances in technology, in particular enhanced digital images, high-resolution cameras, and electronic stethoscopes, mean I can do a physical assessment at a distance. Daniel hardly misses a clinic visit these days. He is knowledgeable regarding his medication regime, and he tells me he feels confident in how we are managing his care together. In addition, we have transferred our knowledge to his local healthcare team, a great patient-centered care partnership.
My passion is fishing, and in the winter, of course, ice fishing. I can usually be out on the lake ice fishing about 30 minutes after my follow-up appointments with my bone marrow transplant team at the Princess Margaret Hospital. During the appointment, my nurse Janice will review my blood work and any medication, as well as listen to my chest and look into my mouth. Then she will make suggestions to manage any symptoms I have and for the weaning of my medications. You may be asking yourself, how is it possible for me to receive follow-up care from the transplant team in downtown Toronto and still go ice fishing? Well, it's because of telehealth. I leave my home and I'm at the hospital within a minute and 30 seconds. 10 minutes later, I'm meeting my doctors in Toronto within the hour and on my way, getting on with my life. Telehealth saves me so much time. To get to Princess Margaret, I need to travel 800 kilometers one way. I will often leave home on a Sunday for a Tuesday appointment. I can't drive it all in one day. I get tired. I will leave myself extra time so I don't have to rush. So I am often gone for 3 or 4 days and 1,600 kilometers to drive in, and I won't tell you how much money, but it's a lot of money too. I get some back from the Northern Travel Grant, so the government helps us out, but it never covers everything. Okay. At my recent telehealth appointment, I was explaining to Janice, my transplant nurse, that just lately I had an infection. My local team helped me a lot, but they need to understand what it means for me to be immunosuppressed for 5 or 6 years. In the past, they would prescribe me a week's medication when I needed to have 6. The nurse that cares for me in my hometown had learned so much from the expertise that my Princess Margaret team shares with them. They really get to understand my illness more. I have progressed over the last 6 years. It's been a long road, but has a lot of good in it. I am actually very surprised I am still alive. I turned 50 years old this year, and when I went for blood work, I was number 50. It must be a sign. I am just so grateful for the telemedicine and Princess Margaret Hospital and everyone that is involved in it. There's a lot of people behind the scenes, the telehealth teams in Toronto and in Cochrane, all my doctors, Dr. Mesner, Dr. Lipton, my nurses, Janice, Mary Jane, and Abigail. It's all a bit overwhelming, the quality of care that I have received since 2002 when this all started. But it's been a long road with a lot of good in it. Telehealth has been a godsend to me. This is the best I have felt in a long time, and when I need help, I know whom to call and that they are there for me.
As a registered nurse and a telehealth program coordinator at University Health Network, I have a passion for transforming the way healthcare is delivered. As part of a patient-centered approach to care, telehealth technology can have a positive impact on both the lives of patients and healthcare professionals. Telehealth is an umbrella term to describe any form of healthcare that is provided at distance. It's also known as telemedicine. However, within our organization at UHN, telehealth refers to the use of live, two-way video conferencing for the delivery of healthcare services at distance. Primarily, we use telehealth video conferencing to overcome access barriers such as geography, time, distance, and lack of specialists in rural areas. For us, this means we are not only enhancing patients' access to care, but are also facilitating clinicians' access to a technology that is compact, portable, and easy to operate within their clinical workflows. Initially, we used studios in our corporate offices, but that didn't work. So we initiated our Take It to the Clinic approach, where we build mobile video conferencing units to be used in the clinical areas themselves. In fact, this has been so successful that we have needed to transition to setting up satellite studios in some clinics, rather like the bone marrow transplant unit. We can access communities across Ontario through our partnership with the Ontario Telemedicine Network. Being Canada's largest telemedicine network, they have studios located all across the province, mainly in hospitals and nursing stations. And as part of a larger provincial e-health strategy, there are plans to have telehealth video conferencing available in every hospital and long-term care centre in Ontario in the near future. Maintaining privacy and confidentiality during a telehealth visit is essential to us from both a legal and ethical perspective. The Telemedicine Network has addressed these concerns by embedding encryption technologies in their virtual private video conferencing network. The opportunity to address the needs of oncology patients across Ontario was identified by Janice and her team following a presentation we made on our program during monthly rounds at Princess Margaret Hospital. Dr. Mesner and Janice shared a vision for a reliable, secure, low-cost intervention to bring care closer to home, and we in telehealth made it happen. Some of Janice's group were initially skeptical as to the feasibility of using telehealth for the complex care of their outpatients. They insisted that they needed an easy-to-use service that could provide access to rural communities, as well as giving an excellent picture and sound clarity from the patient. Plus, minimal impact on the normal clinic workflow. A tall order maybe, but I knew we could deliver. Our expertise lies in really teasing out what is the same and what is different in a clinical visit when a patient is seen through video conferencing. For example, often a patient will have their blood work drawn at Princess Margaret right before their appointment. But of course, if it's a telehealth visit, we need to have this coordinated to be done in their home community and the results available for the clinician to review at the point of care, right here in Toronto. Access to specialized oncology nursing care poses a particular challenge for Canadians who live in remote areas. They often have to overcome significant geographical and weather barriers in order to access their care. And furthermore, traveling to these specialist appointments is a great burden on individuals who are already compromised due to their illness. It was early in 2005 that we introduced telehealth to the ambulatory bone marrow transplant clinic at Princess Margaret. For some telehealth visits, it's essential that our nurses can closely examine different parts of the body. We can ask the nurse at the remote site to use a high-resolution handheld camera to provide an extremely clear view of the area of interest. For patients like Daniel, this would be his oral mucosa. These views can be magnified and frozen on the clinician's screen to assist in the physical assessment. Our experience of using telehealth for the bone marrow transplant patients has been very positive, but it has not been without challenge. Time management becomes a key issue when integrating an e-clinic into regular clinical workflows. Since airtime is booked for each visit, as well as studio space at Princess Margaret and the local hospital, the patient's appointment must begin and end on time. However, in the final analysis, telehealth improves access to care, enhances patients' quality of life, and their satisfaction with care across the continuum. As a coordinator bringing care closer to home, I'm proud to be part of it.